Hey everyone, Dr. Leo Krawetz at Healthy Feet Podiatry. I've got another patient with an ingrown nail today, but this one's a little different. She's got pain on the side of the toe, but on both sides, here and here. And the reason she has that, if you look at the nail and you look underneath the front of it, you can see that it's lifted up and you can see fungus under there. Antifungal won't work for this, and pills that you take for fungus really don't work that well either. She's been dealing with this for at least the last year. It's been worse, and then several years with this as an ongoing problem. So we're at the point now that if we remove both sides of the nail, because it's lifted, when she gets any pressure on this dorsally, it's still going to be a problem, because even if I take these sides out and you have this much of the nail left, it's still going to hurt her when she wears shoes and the shoe pushes against the nail. So we have decided to take the entire toenail off. So she's numbed up. I put lidocaine with epinephrine in there. There's a little bit of epinephrine, and that just keeps it from bleeding. And that's why you're not going to see that much blood, although it does bleed more than your typical nail procedure. Because we're taking the whole nail. So she's numbed up right now. I'm going to loosen the nail, and what I do is loosen it from the epinicium. That's the back part here under the cuticle, and you can see I'm loosening this cuticle up here. And the main part we have to make sure we get is on the sides too. I'm going to wipe this off here because we want to make sure we get every bit of this nail so she doesn't get a nail spicule growing. And the interesting part about this, you can see when I put this freer here, I can actually flip it backwards on itself, and I'm riding the underside of the nail forward this way to create just a little tunnel here that I can stick a hemostat in and actually spread the tissue away from the nail. So you can see I've got that under the nail right now, and I can move it back and forth. That's creating a little bit of a tunnel. And yes, it still bleeds, even with the medicine in there. But now I can take a curved hemostat, and I used a curved stat because I can put it under the epinicium, flip it back on itself like this, and it's going upward rather than downward to not hurt the nail bed as much. And you can see I'm kind of moving this back and forth, and you can see now it's underneath the nail, and then I can spread the hemostat and actually loosen the entire nail. I can shove it from this side too as well and actually turn the nail to pull the remaining part out. There's not that much left. And I went through the kind of near the center because it's already loose in the center, and you can see the nail coming off right here. See how I got the whole nail in one shot. There's a little bit of dead skin left there, and that's just callus from where the nail's been digging in. But you can see that's the top of the nail, and that's the underside of the nail right there. And that's a pretty good view of what the nail looks like underneath. And you can see it's pretty damaged underneath. You can see the fungus at the tip of this nail. I'm gonna point to it with the curved stat. This is a lot of the fungus in the nail, and this is chronic thickening of the nail. A lot of this, if I sent this to a pathology lab, it would probably come back chronic trauma and chronic thickness from the chronic trauma to the nail itself. And you can see some of this nail actually looks a little bit normal back here. But this will always be a problem because she's getting the constant trauma to the nail. So now we're going to clean out the nail bed itself. Make sure this is nice and clean. A lot of this stuff I can just pull right off of here. And some of it I'll use a tissue nipper to make this nice and clean here. And then we can put the chemical so it won't grow back anymore. If you look, what I'm doing is I'm taking this hemostat and going under the epinicium to feel. This is all by feel. It should be nice and smooth and uniform, so I know that I did not leave any nail in there, and I did not feel anything in there. Okay, the nail bed itself is in pretty good shape from where we took it off. There is a little bit of trauma right here. You can see a little indentation, and that's actually from where the nail was chronically being injured, and the thickening of the nail was digging into the flesh itself. So now we have a nice dry field here. I can put the sodium hydroxide on under the epinicium, so this won't grow back anymore. And again, this is just like when we do the partials. We do it for about 10 seconds, but I have to sweep this across the epinicium back and forth so it's pretty even. I don't want blood in there, so I'm gonna try to keep this dry too at the same time. So there's one stick. 2 more to go here. And again, I keep this as dry as possible so we can get the full effect of the sodium hydroxide. And this is killing the nail matrix itself. The matrix is all the nail cells under the epinicium. You can see how far it goes when I push this underneath the cuticle, which is also called the epinicium. And now we'll do one more stick here. This is the last one. And this will be 10 seconds here. And you can see as it burns it, it actually turns it almost like a whitish color. You can tell that it's burning the nail itself. It's cauterizing it too. And then I want to do one last little twirl back here in the corner and one last in this one, because if there's regrowth, a lot of times it'll be in the corner of the nail. So we want to make sure we got that pretty well. And then we're going to take some vinegar. And I'm going to flush this real well because there's actually a little more than I usually do with the partials because we did the whole nail. And that's the whole procedure. Now I'm going to wrap it up. We're going to put a betadine soaked adaptic on there. And then we're going to cover this up with a dressing. Let me see if I can find my leading edge here. I'm going to grab a scissors to cut this off. Make life easier. And looks good. You can see it's going to start bleeding a little bit here. But the nail's gone. The nail matrix has been destroyed, so it should not grow back. Usually the chance of regrowth is less than 5%. And now we're going to put a nice dressing on this. I'm going to add a little bit extra gauze because sometimes these tend to bleed through, so we're going to make this real puffy here, just in case, and then we're going to put compression on this bandage here too. But not too tight. And you can see, she's got a nice pink toe here. She'll remove this tomorrow, and I'm going to have her soak this in white vinegar and water. The reason I'm going to have her soak it is because we destroyed so much of the matrix, she's going to get a lot of drainage afterwards. And it helps draw the fluid out and it helps basically neutralize that chemical that's coming out of there. So we do a couple tablespoons of white vinegar to about a pint of water. Then she'll put a gel in there called hydrogel and cover with a Band-Aid and maybe some gauze if she's getting excessive drainage. This is going to feel great for her probably within a week. It will be sore because when you take the whole nail off, it's more trauma to the nail bed. So it'll be sore for the first week or so, but she'll be able to wear closed-in shoes within a week to 2 weeks. And then she'll be on her way within about a month because there won't be any more drainage and it should be completely healed up. Thanks.